Good afternoon. Jason Paret, Catalina Island Medical Center CEO. I didn't really come with a presentation. I didn't know I had one. But I'm here to answer any questions that you may have.
Jason, when we spoke this morning on the phone, I was really hoping that you would talk about the testing procedure and the time frame once a patient calls the clinic, when you evaluate the day, if they're testing that day or the next day, their high risk, the low risk, and how much time it takes.
Yes.
Yeah.
So since the advent of additional, so initially everybody knows we had 2 cases, and then recently we've had an additional six more cases within the past week or 2. And so the hospital has been inundated with testing. Yesterday we tested over 73 people. When I left the facility just right now, we tested 45 people. What we are requesting is that individuals call the hospital. Earlier in the morning is better. Thank you. Call in the morning. We will schedule an appointment with you to have a telephone appointment with a physician or a provider, in which at that time we will assess and have the conversation as to how much risk you bear of contracting COVID with the situations that you are in. And if it is a really, really busy day, we might ask you if the risk is very low compared to other individuals, if we could test you the next day or the day after based off of the amount of volume. And I would like everybody to remember, we still are running a clinic. We are doing more testing than we've ever seen before. We also have the long-term care, the ER, and we're doing that with the same number of staff that we've been employing since the beginning of this. So once you get tested, our only option at this time is to send the test to Quest Diagnostics. We have ordered a machine so that we can conduct the testing and have same-day results here on the island. I don't know if we would be able to do 73 in one day with the machine that's coming, but within a day or 2. That machine cost us about $35,000, but just as everything related to COVID, it's taking longer to get things than what we expect. So we have been told that we should receive it within 4 to 6 weeks, and that was a week or 2 ago. And when that arrives, it'll be better. Prior to the giant surge that has occurred within the past couple of weeks, compared to what we were seeing on a daily basis of newly detected cases, it was taking around 2 to 3 days for turnaround once you sent it to Quest Diagnostics before you got your results back. Because of the large numbers that are occurring in LA County, Orange County, and all of Southern California, it's taking now up to 7 days before we get a turnaround on those tests. We do not have control of that. We cannot get Catalina prioritized to be faster than anybody else. And so we just ask for people to be patient with our ability to conduct testing. Everybody else is having this problem.
Mm-hmm. And in the meantime, you're telling those people to quarantine themselves, right?
Yes.
Don't go to work.
I mean, if you have been in contact with an individual that had COVID or potentially, we're following CDC guidelines and informing people what they need to do.
Okay.
And you can find, if people have questions about COVID or want to learn more about COVID, come to the CIMC website. We have a plethora of information about COVID. If you're really curious, tune into the City Council meeting next week. We have the infamous Dr. Davis going to be presenting. And so you'll learn a lot about the new changes and the things that are going on. I think that we are exceptionally privileged to have so many researcher-type physicians that are working with our facility and understand this disease.
And on your CIMC website, I would assume, as I assume the city has all of those protocol, and if you think, like Erlinda Chico sent out that stuff in response to somebody in town today, very specific and very well outlined. I'm assuming we have that and you have something similar.
Oh, yes, we have all of it.
And so it's just amazing with all the information out there, and as many times as people say, and it's in English and Spanish, and you say, this is what it is, but we still continue to get individual inquiries, and people are, and it's all there if they would just take the time and tune in and listen and that kind of thing. That's what's getting old for me. It's not necessarily wearing the mask. It's that the people keep asking the same questions, and it's tough for us as 5 people and Denise and Michael and everybody else and Chief to be responding, because we want to make sure everything is said consistently, and the best way to do that is getting it from CDC and Department of Public Health and CIMC. So thank you.
Can you also have to remember we're on an island. It's a small facility that was never meant to handle what's going on. If you go over to the mainland to get tested and you go into one of the mobile clinics, you're going to get lined up. It's going to take a while. It's not boom, 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 boom. So you have to understand logistics of being on the island and being CIMC. It is going to take a little bit longer, but that's just the nature of where we are and what the facility is. Right. So with people complaining that they had to wait, I'm sorry. That's what happens here. We don't have the ability to rush everybody through. We need to make sure we're doing it right. So I just wanted to say that, and that people have been complaining about that.
You know, and I was speaking to a friend that has a parent that lives Temecula area, and she went to get tested today, and it is a 6-day turnaround for them also.
Right.
And plus, she had to spend hours in line in order to get tested. Whereas with us, all we're asking is that we have a conversation with you so that we can explain, you know, how the test works, the potential for false negatives if you're asymptomatic. You know, we want to inform the patients prior to them getting the test as to, you know, what's going on and what's going on in your life, so that we can help you navigate this new world that we're in, right, rather than just doing a blind test. And then, you know, if you get a negative result and it's a false negative, you know, you're going to feel empowered, and you might go to your friends, go to your parents, you know, and see what's going on. I do know that, like UC Irvine and Hoag, they are getting slammed right now.
Yeah.
I mean, one person described it to me, the line of number of COVID patients coming to UC Irvine right now is like going to an In-N-Out burger. There's just a line waiting outside of the hospital to get in and get tested.
Mm-hmm.
So it's not just us, it's everyone.
Right.
As far as the cost, because I've heard that before, there is no cost. If you call the hospital and you have insurance, there will be no copay, there will be no deductible for the physician visit or for the test. If you do not have insurance, we bill the federal government for it. So there's no copay, no deductible, as long as the primary reason for being tested for the visit is COVID.
Right. Okay.
Okay, question. I know you just mentioned the asymptomatic. Would you be able to clarify or maybe let the public know if you have been in contact with someone that is positive, it becomes urgent for you to take the test instead of waiting, you know, because of the chance of you possibly being positive and still being around public and, you know, causing more of a spread. So if you've been in close contact with someone that's positive, is it urgent for them to go? But is it urgent for them to go get tested as well? And some are not self-quarantined, that's the problem here. And they're not getting tested, so that's the concern.
I think that would be a good question to ask Dr. Davis next week.
Okay.
But the first
I'm
thing-
not going to espouse medical advice when I'm not an expert at it. I spend time on Facebook, but it doesn't give me the credentials.
But I mean, truly, if you should self-quarantine, if you know you've been in contact with somebody
Exactly.
and had sex with them or whatever else, you know, self-quarantine, you know.
If you've been in contact with somebody that has had it, you should self-quarantine and make an appointment with the
Right.
provider and have that conversation with them. and they will give you the proper direction as to what you need to do.
Yeah.
Could I maybe ask a favor? Because I was looking on the website. I appreciate what you're saying about all the information is on the website, but you guys have done a great job, so much so that there's like a whole bunch of pages of information. Now that we're experiencing COVID, it's our sort of run of it. Can you guys pin the CDC thing closer up on the website, closer to more of the front, meaning page 1 versus page 5 or 6 or wherever it is, just so people can go and, do you understand what I'm trying to say?
I'm sure that Tina is listening right now, and she's already
Okay.
working on it.
Because one of the questions that, we've gotten, and I'm not expecting you to just know right off the top of your head, but one of the questions that we're getting is, what do we do now? So, you guys don't want, 50 employees from, or I shouldn't say it like that. You guys may not want 50 employees from town in one day because they may have walked by an establishment that had a case. I don't think you want all of those people calling for a doctor's appointment. So it's really, I'm trying to get, what do you do if you're a business or you're next door to a business or something and somebody has tested positive? You don't necessarily want to shut down your business, but what are the steps that you should
You really don't have any
take?
risk either.
Really don't have any what?
Risk.
Any risk.
No,
If you're a
I don't think
business
so,
next to
but-
another business and they had somebody had COVID.
Well, yeah,
and
that's true,
You're not at
but-
risk.
But I guess if I walked into an establishment on Front Street and walked out and passed by someone else and walked into the next establishment, or if I was, the thing is that we don't know. So we don't know who is a carrier and who's not. So in our community, everybody is all over the place.
Right.
There is no clear contact tracing that you can
Can
do.
I say one thing? And
Yeah.
I don't mean to be flippant, but that's what the hell these are for.
And this.
And this.
Yeah.
That's what that's for. And it's ticking me off that people aren't wearing these. But no, I totally understand where
Yeah.
you're coming from. And I didn't mean to be flippant about it, but
Right.
I'm just getting so frustrated with people not washing hands or staying apart or the face mask. And
Yeah.
I've had that happen in my hotel where I'll get a family come in to check in and they all want to come in the office. It's like, no,
Yeah.
I don't need all 6 of you in here.
Yeah.
So, yeah,
I know.
Because I think this is pertinent to the conversation that you're going to have. And of course, I'll throw out the disclaimer. I am not a medical provider, but I have been surrounded by medical providers for 30 years, understand infection control. I am less worried about the coworkers at any given restaurant. Any given restaurant, giving it to another coworker. And the reason being is they have a mask on, they have a shield on. Where I get concerned is after they leave work and when they go home and they're living in a multifamily home and when they're with their friends playing poker or having a house party because all the bars are closed. I think we all heard it a week or two ago. The bars weren't open and you could hear all the different parties happening around in different houses and people yelling, people screaming. And it's all about the number of droplets that are being expelled. And so when you're in a bar or in a house party, you're yelling at the person next to you just so that they can hear you without a mask. And that's really how it's going to be transmitted. And I would also say, now, and I'm not a contact tracer, but I would say with the cases that we've had, most of them, and it could be elsewhere, but I would say that they are coming from residents that are traveling over town or elsewhere and bringing it back to the island. It's not coming from the visitors. I'm not saying that it couldn't. I'm not saying that they shouldn't be wearing their masks. But from what I can see, it's from the residents going elsewhere and bringing it back.
I appreciate that. It's a complicated thing to say, but it's a true statement. And it's very difficult as we're trying to find balance between our city's solvency and economic viability, balancing that with the safety of the community. And it's, we hear a lot about the visitor, and yet, here we are, and it wasn't necessarily the visitors. So, and I don't know that for a fact. I just know the couple of the emails we've received. Others are sharing that information with the council. So, of so and so and so and so. So, and that's locals, not visitors.
Yeah.
So
A lot of these people also, we need to remember that they work 2 to 3 jobs. So this entire town shares employees. So once someone has close contact, everyone has close contact. So eventually no one's going to be able to work because everyone has to isolate. And that's my biggest concern.
Well, the biggest concern, but I'm hearing what Jason is saying. It's not, if the employers and the employees are doing what is required, they would be safe.
Right, but if that was happening, we wouldn't be having 8 cases.
But who says they came from the workplace?
Right, but I'm just saying, we have
I
to,
know.
the number is the number and we can't change it.
Yeah, but I think I agree with him that it's coming. The first 3 or 4 cases came from over town. I mean, it's so. Anyway, people just have to be individually responsible, and they're just not being that. So
The question I have, Jason, has to do with people that have been diagnosed that are expected to self-quarantine along with their families. Are there, I know LA County has Project Room Key. I know that there had been talk of having the ability, if necessary, to have to quarantine people, that there are some basic plans that the city has. Is any of that being looked at or needs to be looked at based on the individuals that are reported sick? Do we need to look at isolating families from those family members that are sick to help make sure that they don't also get it if they're not infected yet? How does that work? Should we be doing anything with regard to that?
I think that would actually be a better question to Dr. Davis than to me.
Okay.
Project Room Key would be a great thing.
Yeah.
It's not something that the hospital can implement. We don't have the access to the capital to rent an entire hotel for an infinite period of time.
Okay.
that's something that I think we could look into with the county.
with the
Okay.
county.
I
Yeah.
just don't know if it's a need right now, if people in certain families are not
Right.
already sick and should be quarantining separately to avoid infection if possible.
Well, if the family's already together in the house,
Right.
Yeah.
they all should
They all
quarantine.
have to.
Okay.
Yeah.
There's no reason to separate them. They should all be quarantined.
Okay.
Okay, so even if like one's negative, one's positive, everyone should just quarantine, isolate? Okay,
Because, yeah, they've
Because
been
they
in,
could be asymptomatic, and
yeah,
it's from what I understand, if you have it and you're asymptomatic and it's early on in the stages, it's harder for the testing machines to be able to detect a positive result, and so that's why you might get a false negative. As the symptoms start to kick in, it's easier for the machines to detect the COVID virus.
Okay, yeah. So everybody quarantine.
And then
Right.
with that, are there services, and maybe this is more of a Dan question, but are there services that we are offering to do any grocery shopping for these families so they're not having to leave their household or pick up mail or anything else like that right now?
I know that we have been helping. We check in with the family every day,
Okay.
or the individual every day, make sure that their needs are being taken care of, and we do try and help out where we can help out.
Okay.
And I just want to follow up on Lisa's comment. That actually was a discussion very early on, and I very distinctly remember having a conversation with Herlinda at Supervisor Hahn's office because, and actually Jason and I had some conversation too, and this was very early on about having potentially a hotel that was sequestered on island. So if we even had residents that were positive, whether they go or whether the families go. And I know also with LA County, and I believe it's part of the Project Room Key, that was initially started to allow for healthcare providers to be able to go to a safe place where they weren't with their families. So there is some support from LA County for that, and we'll just go ahead and pick back up that conversation with them.
Thank you.
Other questions, Jason?
So, I mean,
No, I guess just to make it clear, you said if someone in your family is positive, same household, you should also self-quarantine.
yes.
Okay, thank you.
Are there any comments directly related to Jason?
I've received none.
And Mayor, I wanted to let you know that the county did say that they were trying to have a dedicated contact tracer for the city. And that was Janice Hahn's office has put that request in, and we'll wait to see what they can do for us.
Great, excellent. Okay. But I think the other thing that people can do is start, if it's not too late, but it's never too late, start contact tracing themselves. If you go to a party, God forbid you do, but if you go to a party, write down everybody was there, what the date it was. If you go, if you feel like you were in a compromised situation anywhere, write it down, and if you know who it was, so that when they do start to contact trace, really, you can be helpful. You can say the date it was and who you were with, and it makes it a lot easier, because right now I can't tell Monday from Sunday, and it's, so where was I yesterday, that kind of thing. So it's important that people do that themselves.
Yes, and in regards to the contact tracing, when we get a positive case, we fill out a form, we send it into the Department of Health. The laboratory that tests and finds out that it's positive also has to report that to the Department of Health.
Yeah.
Stupid people call me. And then once they receive the form, I have been informed that it's about 4 days before they start the contact tracing, and it is all conducted by telephone.
Mm-hmm. And it was on the news this afternoon before I got here. Some people, it's voluntary how you respond to the tracer. You don't have to say anything, but that is not doing anybody any good by not giving names and that kind of thing. So that's very important.
Correct. They do not have to inform the contact tracer of who they've been around or where they've been. It's all voluntary.
Yeah.
Jason, did they mention that if after the 4 days no one's contacted them, if they themselves could contact the county?
There are numbers that the county supplies. If you go to LA County Health Department, you can see it. If you feel like you've been around somebody or you're contagious, you can call that and self-report.
Thank you.
Great. Thank you.
Thank you.
Other questions?
One more for Denise. For the contact tracing, do we have a timeline of when we are expected to hear back from the county?
I do not, Sarah.
Okay,
I was just told that today. So.
thank you.
Great.
All right. If you have any more questions, you know where to find me.
Yes, thank you.
Thank you,
Thank you very much.